I'm here again at the Marina District in Dubai, and I wanted to talk to you about psychiatry, about biological psychiatry. Is it really true that all mental health is an acute emergency, and that every time a person has a psychotic break or a bad event or they feel bad, and I mean seriously bad, that they need immediate medication and hospitalization? Well, sometimes. It's nice to know that in the past, we would use ice baths, we would use ketogenic diets, we would use sun therapy by putting people literally in the sun because the infrared rays of the sun can penetrate inches into your skull and feed the mitochondria of your brain. And so these ideas are being brought back by modern psychiatrists. I'm just a country chiropractic neurologist, and so I want to talk about some famous psychiatrists that are talking about this. Chris Palmer is a psychiatrist from Harvard, and he's got great books and great YouTube on this topic. We've got Georgia Ede, who is the carnivore and keto psychiatrist that talks about how to treat these conditions without medication. We've got Peter Gocha, who is, admittedly, I've talked before about, and he differs from me on the idea that he doesn't think food has much to do with psychiatry, but he tears apart, and rightfully so, I think, the medication model of pharma and mental health. The idea that these drugs are actually antipsychotics is really not true. And he just dismantles that very, very well, despite the fact that I disagree with him that food doesn't help anything. I think we would use William Walsh as a guideline to show that actually food does have a lot to do and biochemistry has a lot to do with mental health, and we can change things without medication by looking at simple blood work and changing people's supplements and people's diet. So that's a walshinstitute.org. I think that it's important for us to realize that there are other psychiatrists, other neurologists, other neurosurgeons. There's a neurosurgeon named Anthony Chafee who talks about the carnivore diets and how simple they can be and how toxic plant lectins and anti-nutrients can be, not just lectins. So I think that if we can understand carbohydrates, lectins, anti-nutrients, the deficiencies that are in food, and above all, one of the big factors is these plant-based B vitamins. I'm really having trouble in my practice with my patients that are on these single B vitamins like B12, folate, B6, or even a B complex that has those things in it. Those are plant-based, and they're very often processed by industry, and they're not as easy to use, and they're not as safe. I mean, they're not causing disease, but they're causing anxiety, and they're causing a number of problems with people. They certainly can cause sleeplessness and anxiety, and they lead to some pretty serious biochemical imbalances. I think it's really important to understand that B vitamins come from animal products. If you can't eat dairy like me, then you just eat meat. If you need to eat organ meat pills instead of eat organ meats, that's fine. Get yourself some grass-fed organic beef organ meat, mixed organ meats that are hearts and livers and kidneys and lungs, that kind of thing. And because not all organs have the same amount of nutrients in them in the same proportion. So you need to do that. You may need some cartilage. You may find that on a carnivore diet, you still have problems with your cartilage in your skin. If you do, you may need more cartilage because cartilage has different ratios of different amino acids in it, which would help form structural tissue like nails and skin and joints and joint cartilage. So you may find that you need to have a supplement of some kind or get some kind of more involvement with cartilage powders, cartilage pills, tripe soup, Vietnamese soup, Thai soup. These are things that are made with organ meats, and they can often give a person liquefied as well as edible forms of cartilage that come from some of the more stringy types of meats, the chewy ones, things that aren't so easy to chew, like chicken feet. If you don't like that, you can take it in a powdered form. You really don't have to be in any way unpleasant if you don't like it. There's something available. Now is the greatest time in all of history, I think, to be having mental health problems and to need to do things with nutrients and with supplements. It's most available. It's the most cheap. It's the most variety that we've ever seen, probably. So it's a great time to have a problem with mental health that you want to fix naturally.